Okay, so for our first movement, we'll do flexion. So flexion right here. And so that's basically where the angle of the joint is diminishing. So the humeral ulnar, so your elbow joint, is diminishing in the angle as the antebrachium is moving towards the upper arm right here. Okay? And then extension would be that return movement from flexion as the humeral ulnar joints, the elbow joint, is increasing in that angle as the antebrachium is moving to about 170 degrees in that kind of anatomical standing position. So both flexion and extension are going to be sagittal plane movements of the bilateral axis. So then we do abduction. So that is going to be movement away from the midline. So an example would be, I'm raising my arm here, and so abduction of the arm as it's moving away from the midline, and with the help of the deltoids and supraspinatus. And then adduction is the movement toward the midline, as the midline is kind of that mid-sagittal cut right through. And so movement toward the midline, and adduction of the arm is coming basically back down to that midline. So then abduction and adduction are going to be frontal plane movements on the anterior-posterior axis. Circumduction is the orderly sequence of movements in the sagittal, frontal, and oblique planes. So the movement is basically in a cone shape. So you can see doing it here and along the side. And so it occurs typically within biaxial and triaxial joints. So in this case, it will be the triaxial joint of your glenohumeral joint as the arm is circling. And so you can just see kind of that cone movement that is forming. So we've got internal, or otherwise known as medial rotation. So it's rotation of the body segment. So the body segment is turning medially. So in this case, we're rotating, we're internally rotating. Internally rotating. And so you've got internal rotation occurring right here at the glenohumeral joint as the humerus, okay, is internally rotating in the glenoid cavity right here. And then external rotation, or otherwise known as lateral rotation, is rotation of the body segment. So the body segment is turning laterally. And so the external rotation at that, again, at that glenohumeral joint. So the humerus is externally, so back to external rotation, externally rotating at the glenoid cavity. And then pronation, so if you're in anatomical standing position, so pronation would be that internal or medial rotation of that forearm. And so the forearm is moving on that radial ulnar joint, allowed by the pronator teres and your pronator quadratus to have that medial or inward rotation of the forearm. And then supination would be like what you're typically in anatomical standing position. So if you were in that pronated and then you are moving back to supination, so then this would be supination. So you're moving, you're laterally rotating on that forearm, and so the forearm is allowed to supinate through your supinator muscle and your biceps brachii to have that lateral or that outward rotation of that forearm at the radial ulnar joint. So now looking at so dorsiflexion, so that's going to be at the talocrural joint, typically on, so it's on the sagittal plane. And so basically, you're bending your foot to the anterior surface of your leg, basically. So again, so you're moving this top portion to that anterior surface. And so in this, you are tightening the plantar ligaments, even though you're dorsiflexing, okay? And then plantar flexion is going to be the opposite, so it's at the talocrural joint still on the sagittal plane, but the movement is going to be away from the body, so therefore you're tightening your dorsal ligaments. So you're moving again, plantar flexion. And then, so inversion versus eversion. So inversion is, so I'll just do it in one foot. So tilting the sole of the foot, so you're moving it, the sole of the foot toward the midline. So you can see it's kind of like adduction in a sense. So you're seeing the inside of the sole right here. And then eversion, so that's at the subtalar joint. So the eversion is going to be tilting the foot away from the midline, so kind of like abduction, so the subtalar joint, so you can see it's away right now. And so that's for the planes. So now we're doing the different planes as well as the different types of axis types. So we've got the sagittal plane. So an example of that would be if you were squatting. So you have flexion at your femoral acetabular, so at your hip joint, at your knee joint, so your tibiofemoral joint, and then as well a little bit of flexion at the talocrural joint as well. And so that plane is a vertical plane that's passing, so from front to back, and it's dividing into right and left halves. So if you were to do it kind of on like a piece of paper, so this would be the sagittal plane is the paper, and then it's dividing the pencil into the right and left halves. So then if you were to do a frontal plane, so that would be an example of that would be the abduction of the leg. So abduction of the leg at the hip joint, so at the femoral acetabular joint. And so it's a vertical plane that's passing through the body from side to side to divide into the anterior and then posterior halves. So on the paper, so this you can see, it's kind of hard to see, but this is so this would be the anterior portion, and then this is the plane, the frontal plane that's passing through it, and then the posterior would be behind that pencil. So it's dividing into anterior and then posterior on the back half. So then transverse plane is a plane that's, so that would be like if you're twisting your trunk region. So a plane that is passing horizontally through the body, dividing into upper and lower halves. So on this piece of paper, you can see, so this would be the plane paper, so that would be the transverse, and it's dividing to upper and lower halves of the pencil. So now for the different types of axes. So we have the first is the bilateral axis, and so it's passing, so again, kind of that elbow flexion. It's kind of similar example. So if you draw basically a line through the humeral ulnar joint right here, is basically what that bilateral axis is on. So it's passing horizontally. So you can see passing horizontally from side to side. So it's my index finger here. And so if you were to look at an example of this again, so here you've got your sagittal plane, and so this pencil now would be that bilateral axis that's cutting through, so allowing that flexion and extension. And then you have the anterior posterior axis, so that's going to pass horizontally from front to back. So an example would be like the side bend of your trunk. Okay, so side bend of your trunk. So you're moving on the anterior posterior axis, and so it would be again like this paper. So the pencil would be that anterior posterior axis, and so you allows that kind of abduction and so abduction and some adduction here, and so you can kind of see the plane moving. Okay, and then on the vertical axis, so if I were to shake my head no. It's kind of like you stick something like through the middle of your head here that you're rotating on. And so this in the vertical axis is going to be perpendicular to the ground. And so here again, so you've got your transverse plane to the paper, and then this axis would be the pencil. So it's allowing for pronation, supination, and then rotations as well. So that is all of the different types of planes and movements and axes.